The organizers for giving me the opportunity to present the Rise Up Phase 3 clinical trial on behalf of all of the Rise Up investigators, some of whom are in the audience today. My disclosures are here on this slide. So hemolytic anemia is a key driver of the complications we see in sickle cell disease. Hemolysis, anemia, vaso-occlusion all contribute to progressive, cumulative organ damage in sickle cell disease. Acute anemia and hemolysis in patients with sickle cell disease adversely impacts their entire quality of life, causing fatigue, shortness of breath, and devastating jaundice. Chronic anemia in sickle cell disease is associated with a higher incidence of negative clinical outcomes and an increased risk of end organ damage and mortality. Therefore, disease-modifying therapies that address the hemolytic anemia are essential to improving the clinical trajectory for these individuals. Mitapivat enhances red blood cell metabolism by activating pyruvate kinase, including the red blood cell specific PKR and the PKM2 isoforms. The Mitapivat clinical development program includes more than 10 years of experience with consistent benefits across the hemolytic anemias, as well as a defined safety profile with over 1,300 patient years of exposure, which has led to approval for 2 indications in adults. Rise Up is a global phase 3 randomized double-blind placebo-controlled trial of oral Mitapivat in patients with sickle cell disease. Patients were randomized in a 2-to-1 ratio to either oral Mitapivat twice a day or matched placebo for the 52-week double-blind period. This was followed by an optional 216-week open label extension. The key inclusion criteria included being 16 years of age or older, having any sickle cell disease genotype, an average hemoglobin at baseline between 5.5 and 10.5 grams per deciliter, and with 2 to 10 sickle cell pain crises or SCPCs in the year before randomization. These SCPCs included acute pain, acute chest syndrome, priapism, or hepatic or splenic sequestration. Key exclusion criteria were chronic transfusional therapy and disease-modifying therapies other than hydroxyurea or medications that increase hemoglobin. Randomization was stratified by the number of SCPCs in the prior year, as well as hydroxyurea use. The phase 3 Rise Up trial has 2 primary endpoints, and achieving either was considered a positive outcome of the study. These 2 primary endpoints are hemoglobin response and annualized rate of SCPCs. The key secondary endpoints were assessed according to the hierarchy that's shown on the slide. In addition, post hoc analyses were performed to assess the impact of Mitapivat on transfusion burden and the benefits of Mitapivat in hemoglobin responders. In total, 207 patients were randomized 2-to-1. 138 were assigned and received Mitapivat, and 69 were assigned and received placebo. In the Mitapivat arm, 13% discontinued during the double-blind period, with a similar discontinuation percentage in the placebo arm. Importantly, 85% of patients completed the double-blind period. Additionally, 174 out of 176, which is 99%, chose to enter the open label extension period, which is quite remarkable for a sickle cell disease trial. Baseline characteristics were overall well balanced between the arms. Approximately 75% of the patients were on hydroxyurea. The mean hemoglobin at baseline in both treatment arms was around 8.5 grams per deciliter. The mean number of SCPCs in the 12 months prior to treatment in both arms was 3.4. 1/3 of patients had had a transfusion in the prior year. In general, patients were representative of the global population of individuals living with sickle cell disease. Mitapivat met the primary endpoint of hemoglobin response compared with placebo, which was defined as an increase of 1 gram per deciliter or more in average hemoglobin concentration from week 24 through week 52. In the Mitapivat group, 40.6% of the patients achieved the primary endpoint, compared with only 2.9% of patients on placebo. Note that in this waterfall on the slide, each vertical bar represents an individual patient. The dashed line represents 1 gram per deciliter change from baseline in the average hemoglobin from week 24 through week 52. And as you can see on the waterfall plot, the majority of patients treated with mitapivat had an increase in hemoglobin. Furthermore, among the patients in the mitapivat arm who achieved a hemoglobin response, the average week 24 through week 52 change from baseline in hemoglobin was 1.6 grams per deciliter. Hemoglobin response was not driven by any pre-specified subgroup, including the use of hydroxyurea. Significant improvements in hemoglobin, as well as decreases in indirect bilirubin, were demonstrated for patients in the mitapivat arm compared to placebo. As you can see in the figures, improvements in hemoglobin and indirect bilirubin were rapid as early as week 2 and sustained through week 52. Additionally, improvements in hemolysis were accompanied by favorable clinical trends in other primary endpoint of SCPC and key secondary endpoints, but these were not statistically significant. A clinically meaningful reduction in transfusion burden was observed for mitapivat versus placebo. And when looking at the percentage of patients requiring a transfusion, there was a 41% relative reduction for mitapivat versus placebo. Furthermore, there was a 56% relative reduction of red blood cell units transfused for mitapivat versus placebo. It's also important to note that transfusion benefits were observed in patients with and without concomitant use of hydroxyurea. The impact of mitapivat on transfusion burden was actually more pronounced than historical therapies. Now, looking specifically at the hemoglobin responders, improvements in sickle cell pain crises and healthcare utilization were more pronounced and clinically meaningful in hemoglobin responders compared to hemoglobin non-responders in the mitapivat arm. There was a 26% reduction in the annualized rate of SCPCs, a 53% reduction in ER visits for SCPCs, a 34% reduction in the frequency of hospitalizations for SCPCs, and a 37% reduction in the annualized rate of hospital days for SCPCs. Hemoglobin responders in the mitapivat arm experienced greater improvements in fatigue versus non-responders, and note that reductions in scores on this figure represent improvements in fatigue. Importantly, the magnitude of reduction among hemoglobin responders exceeded the clinically meaningful change threshold, which was not reached by the hemoglobin non-responders. In addition, hemoglobin responders experienced consistent improvements in how they felt and functioned compared to hemoglobin non-responders. This included pain, physical functioning, sleep, and overall health status. Mitapivat was well tolerated with an acceptable safety profile in patients with sickle cell disease. There was actually a similar percentage of patients with any reported TEAEs, including grade 3 or higher events, in the mitapivat and placebo arms. The percentage of patients with discontinuations was actually low for both arms. There was an equal frequency of patients with TEAEs leading to deaths in both arms, and none were considered treatment-related. The most commonly reported TEAEs were similar between both arms. In the Rise Up phase 3 clinical trial, mitapivat demonstrated a strong anti-hemolytic effect, which resulted in clear clinical benefits, including a significantly higher proportion of patients with a rapid and durable hemoglobin response compared to placebo, and a reduction in transfusion burden compared with placebo. And for hemoglobin responders in the mitapivat arm, a clinically meaningful benefit was observed in SCPCs, healthcare utilization, and fatigue. Mitapivat was generally well tolerated with a safety profile consistent with previous studies of mitapivat in sickle cell disease. These findings altogether reinforce the consistent benefits of mitapivat across the hemolytic anemias and its well-established safety profile. In conclusion, this pivotal study is the first to validate pyruvate kinase activation as a new treatment paradigm in sickle cell disease. Mitapivat, through its oral administration, a novel mechanism for improving hemolytic anemia, can be an effective and convenient disease-modifying treatment with or without hydroxyurea for patients living and struggling with sickle cell disease. I want to give a special thank you to all the patients that participated, their families, and all the many investigators involved around the world in the Rise Up trial. You can scan this QR code if you'd like additional supplemental information. And that's the end. Thank you. I'll take questions.